We need a new grand bargain, and this requires the recognition of our different constitutional responsibilities and what we can all do best. Now, provinces have the responsibility for delivering health care, and that requires more adequate, and more stable federal funding than we've seen in recent years. Full provincial control is necessary to deliver health care to our citizens. So why not recognize these two imperatives together? Provincial recognition of federal responsibility and leadership for a united economic union that addresses interprovincial trade barriers, and federal recognition of the need for adequate health care funding under provincial control. These are challenging objectives. They require understanding, and above all, they require leadership. If we are to deliver the transformative action that's truly needed, Manitoba is going to continue to do our part. We'll continue to advocate for common purpose. I'm going to be following up with my fellow premiers. I am reaching out to industry. I'm reaching out to policy leaders in the business community to canvass support, some of which we've already received, and to secure additional input as well. As Premier of Manitoba, I'm going to continue to push for federal legislation to create a stronger economic union and fully realize what was intended at Confederation. And I'll continue to advocate on behalf of Manitobans and our fellow Canadians for the federal resources required to discharge our healthcare responsibilities to all our citizens. If we're going to recognize federal authority here, there's going to need to be a trade-off, and I think the logical one is that we have greater assurance that we get a partnership with the federal government on funding. We've seen our funding here decrease from around 25% just a few years ago to now getting down into the 17% range. And that means more of a burden on our provinces, not just ours, but others across the country. And you're seeing that with longer wait times in nine of the provinces in the last Canadian Institute of Health Information report. We're the only province making headway on wait times. 9 others aren't. And so we need to address this. Healthcare is the #1 priority for Canadians, and we deserve to have a stronger system. But we also need to have a stronger economic union. I think we can achieve both those things with the right dialogue.